Hello everyone, this is Congressman Keith Ellison, and there's no doubt about it, drug pricing is just at a crisis state. I can tell you that I've knocked doors, I've been at community meetings, I've been at rallies, and I've been all kinds of places talking to Minnesotans and people outside of Minnesota all out this country. And one of the things that is a recurring theme is that people cannot afford the drugs that they rely on to live. I've talked to women who were on insulin, who've told me that their insulin prices have spiked to the point where they simply don't know what they're going to do because they can hardly afford it. I've talked to men on Daraprim, and they've told me that they cannot afford the medication that they rely on to live. I've talked to people who are on chemotherapy who explained that their drugs are $8,000 a dosage, and that but for family, friends, and other sort of special programs in some cases, that they could never afford the drugs that they rely on every single day. When I sit down and I talk to people, just like I did a lady who I was at a meeting talking to, she stared me in the eye and she says, "I gotta talk to you." I said, "Okay." There were several other people standing around, so it was a little awkward that she would draw me out of the meeting the way that she did. But given the look she had on her face, I knew that there was only one answer that was going to work, and that was okay. So we walked over toward the corner of the room, and she told me, she said, "Look, I need insulin to survive. If I don't, I can get really sick and I could die. But the prices have just been spiking and I can't afford it. It's getting to the point where I can't pay for all types of things that I need because I got to have this insulin." She said, "Do something. Do something." There are solutions. The real question is political will. Can we muster enough democracy to simply make these drug companies do what's right by the American people? Time for us to put up with this is over.